Okay, well, everybody's answering the question. We might as well get rolling. I'd like to start out by welcoming everybody out of their COVID hibernation. We hope everybody is safe, and I guess at this point, still sane. Today, we're going to be going over what employers need to know when getting back to work. And as we're looking at the survey question, we're just a little over 70% of the attendees have answered. And it appears that the vast majority, or close to the majority, are stating that keeping the employees safe and compliance is the #1 issue, followed by the spread of the virus to others, the liability associated with that, as well as employees becoming affected on the job. But we will address these as we go through our. So our goal is to run about 35 minutes, then open up for Q&A. In addition to joining myself, David Lang, the head of the risk management department here at Duncan, I'm joined by our HR director, Jennifer Roman, and our senior safety consultant extraordinary, Mike Kuros from our East Coast Risk Management subsidiary has also joined us. So also, please put any questions you have in the Q&A tab. If you see a similar question, I think you should be able to even like the question. That way we know how many people have similar questions and we can prioritize our answers. So with that, so looking at this, obviously the compliance side of this is going to be one of the biggest areas that we need to address for the employers today with this survey, as well as trying to help prevent the spread of the virus, not just to your employees, but to others. So with that, we will end the polling. Thank you all for participating. And here are the results. Hopefully you can all see that. Kind of what we were expecting based on the questions we were getting from our clients. So there's a lot of decisions that have to be made and actions you have to take. When are you going to reopen? How open will you be? Can you reopen, or can you reopen for, let's say, pickup or delivery only? Reopen with limited capacity, or maybe you can open with full capacity. Obviously, the state and federal guidelines will dictate what you can and cannot do. Ultimately, it's critical that you understand your risks and that you have a written pandemic plan and implement it. So when you're making the decisions, you do not want to go and rush things and make the wrong decision. You may want to reopen, but if you bring all your employees back and someone becomes ill, what happens next? What happens when the second or third person becomes ill? Therefore, if an employee can work from home and be productive, maybe not quite 100%, but they can be productive enough, you may want to have them stay there. The less people you have in your operation, the less issues you may have trying to do things. If you cannot have them work remote, you may want to take your time and take pauses as you bring people back in so that you don't have to quickly undo what you've done. But ultimately, these are some of the things we're going to be discussing today. So first off, please do not assume that you are covered for everything when it comes to insurance. For example, knowingly violating CDC or state health rules relating to employee and public safety can open you up for punitive damages, which are not covered by insurance, not allowed to be covered by insurance. If you alter your services or products, make sure you're covered. You may also be able to find some small tweaks or some things to fill gaps in your coverage. But if you cannot cover a risk at all, then you have to create a plan to mitigate the risk. And even if you can cover it, you probably still should go through the process to mitigate your risks. But even as you're trying to address things, there's a clear process you should go through. So as a degreed risk manager, as many of you on the webinar already know, we always start with identifying and understanding what's going on, the risks and hazards. What and how do we need to protect? Who do we need to protect, and from what? Once we have that understanding of the situation, then you can build a plan, implement it, and then monitor and make adjustments to the plan. But this is where I throw in a word of caution. You should go through this process to manage risks once you've identified them. You can see from ranking from the most to least effective means of managing risks from this hierarchy of controls. Elimination, obviously not reopening is really not an option, but eliminating or reducing the risk, say via having as many employees work remote as you can, is a good idea. Substitution is, or sometimes we refer to as redundancy or separation. Consider going to 2 or 3 shifts instead of 1. That way you have less employees potentially exposed at one time. We have some businesses that have also outsourced some of their production because they do not have the capability of keeping their employees from working too close together. Physical controls might mean moving workstations further apart, or utilizing plastic partitions, increasing the airflow and filtration of your HVAC system. You could have administrative controls, where you try not to rotate through, let's say, a cubicle or a job station. Changing workflows to reduce the interaction between employees. Even changing the traffic flow around your facility can make a difference. If you notice at the bottom, the least effective, but yet the one that the media seems to be talking about, is masks, gloves, the personal protective equipment. In this case, it is the last case or the last place you go should something else fail. But once again, it's all about identifying your risks and building a plan. With that, I will now hand the reins over to Mike Kuros of East Coast.
Thanks, David. All right, so going along with what David said, the biggest thing we want to do as individual companies is develop a plan. This is important on many different levels. The main thing is actually to have it on paper so that your employees can see it and acknowledge it. One thing we actually are going to be sending out to everybody, we'll have like a little compliance toolkit. Part of that toolkit after the webinar is going to encompass a template plan. But remember, this is only a start to your specific plan. Each place is going to be different, whether it's a workplace, your school, business. Remember, in all of our businesses, we have maybe our shops and office. So that might, change things up a little bit different. But regardless of what's in your plan, these bottom parts should be in every plan, which is to clean everything, all surfaces with soap and water. They say that is the most effective way to clean anything. A lot of people are looking for disinfectants, that sort of thing. We need to have those as well, but remember, cleaning it with soap and water is the most effective way. As far as your approved disinfectants by the EPA, if you see at the bottom of the page here, there is a website you can go to. So let's just say you guys have some disinfectants or cleaners that have been underneath the sink for quite a while. You can go on the website, type in the name of that disinfectant or cleaner, and it will tell you whether or not it will kill COVID-19. Now, based off the poll I see, as far as cleaning supplies and PPE wasn't a major concern. However, if you don't have any, you could use a 1/3 cup of bleach and 1 gallon of water. And this is actually good enough to kill the virus per the CDC website and EPA. Okay, in the plan, we need to make sure that we're putting in there that we have 1 entrance and 1 exit point. This is important so that it limits the traffic throughout your facility. Remember, one of the things we're going to have to do is clean on a daily basis. So the places you can limit your employees coming in and out and customers coming in and out is going to limit how much you actually have to clean on a daily basis. So we need to make sure we pinpoint those areas. There's also, if it's the same entrance and exit, we just need to make sure we have signage available, such as, wear your mask, practice social distancing, etc. And make sure that people are practicing social distancing at all times in the business. As David said, telework must continue to happen. if it's not necessary to be at the place of work. Now, I know that's a hard pill to swallow for a lot of business owners because they want everybody there working. However, you know, with everything that's gone on over the past couple months, we've seen that you are able to perform your job from home. If those people do not need to be at work, they should not be at work. So continue to do telework. In fact, based in Pennsylvania, every state has their own specific plan. The middle phase, which is the yellow phase in Pennsylvania, they say that telework must continue, okay? David also talked about staggering shifts if possible, and there's many ways to do that. That could be multiple shifts throughout the day. That could also mean maybe having a couple people from each department come in one week, other people stay home and bring the others in the next week so that you don't have many people together. If we do have crews of people, we want to make sure that we're keeping those crews together. We don't want to be switching people on and off on a regular basis for the fact that if somebody on that crew came down with COVID-19, it's not going to wipe out your whole entire company. So if it's a group of 5 people, yes, it will affect that crew, but it's not going to affect everybody. Now, in the state of Pennsylvania, they say that masks have to be worn all the time. That's going to probably be the biggest issue that we're going to have and pushback we're going to have from employees. The only thing I could see is that if the possibilities of not wearing it at all is if you're in an office setting and you're in an office by yourself with behind a closed door. Somebody brought up the scenario, what about cubicle partitions? And my example was, if you ever see light coming through a window and you sneeze, typically you could see that floating through the air. Well, that's the whole purpose of having a mask. The mask isn't meant to keep you safe, it's meant to keep the other people safe. So as you watch the news and you keep continuously hearing about the droplets, that's what's keeping that in by you wearing the mask. So it has to be worn at all times. And I'm sure a lot of us have an employee handbook in place. If you continuously see people disobeying this order, we should actually go to our disciplinary policy and make sure that also that all employees sign off on our policy. We need to have hand sanitizers, wipes, and masks available for your employees. You're allowed to have masks brought from the outside. However, they need to be approved. And if you look on the CDC website, they have approved masks. Basically, at this point in time, the way they have it, if it's a face covering, it's going to be approved. Like I said, this is not necessarily an N95 where it's protecting you, the employee, it's protecting the others. We want to avoid all non-essential travel. So if you have to go meet face-to-face with somebody or have somebody come to your business to meet face-to-face, and there's no way of getting around it, then once again, we have to wear masks and practice social distancing. However, we want to make sure that if it's non-essential, it's done via telework. Also, if your building has an elevator, we want to make sure that we're using stairs instead of the elevator. Make sure that we close the elevator down, post signage. The small area, you wouldn't be able to practice social distancing. Also in that small area, obviously a lot of germs could be in that area. We don't want to use it. And then at the end of the day, what you want to do is clean all the doorknobs and stairwell handrails and whatnot every day. Same thing with all of our commonly touched surfaces. And once again, all of this should be in our plan. So things we got to think about, like tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets and sinks, touchscreens. Now, that's actually going to be part of the plan where we need to actually have somebody at the company do the cleaning on a daily basis. Once again, protecting themselves with the gloves and masks, but also we should have things available for all of our employees. So if there's commonly used areas like the bathroom, let's just say, we should have cleaning materials in the bathroom for them to use and make them clean at the end of every time they use the bathroom. Same thing with maybe if you have a printer, have wipes available there for people to wipe it off. In our kitchenettes, have wipes available for them to wipe off the countertops. The more we have that we could actually have the employees do themselves is going to be better on us in the long run. So one thing, I mean, with everything going on, a lot of people have not been in their offices or their place of businesses for the past 7 days. So if that's the case, what they say is the coronavirus cannot withstand staying on surfaces for more than 7 days. So if you have not been in your place of business for more than 7 days, all you need to do at that point is routine cleaning. Once everybody does come back, then we get to continue with the disinfecting on a daily basis. Now, I'm sure that this is a concern with everybody. And as I discussed earlier, we want to make sure we're separating employees accordingly. For instance, if we have a bunch of employees that are very important to our operation, they should not be all together all the time because, like I said, if somebody comes down with COVID-19, that's going to affect those people that they're around. Now, with the state of Pennsylvania, what they say is the employees that are in close contact, which is only 6 feet for 10 minutes with a person that has a probable or confirmed case of COVID-19 from the prior 48 hours of onset symptoms. So basically what that means is if I was in a group of people at work and I'm around anybody within 6 feet for less than 10 minutes or 10 minutes or more, then those people need to be quarantined as well as myself. So once again, that's why we need to be strategic on who's around who. Okay, if an employee does come down with COVID-19, what PA is saying right now is that we have to do the forehead temperature checks. Now I say forehead temperature checks, what they say is you can do any temperature check, but think about it. You don't want to be using a thermometer that you have to disinfect in between every use. So if you could buy the forehead thermometers, that's the best way to go. The person that's taking the temperatures needs to be trained on how to do so. Also about protecting themselves with gloves, disinfectants, masks, etc., practicing social distancing. But if any employee has an elevated temperature or a fever of 100.4 degrees or higher, that person would need to be sent home for the day. Then they would have to seek medical assistance to see, what's going on with the employee. Now, my suggestion is here to purchase these temperature gauges ahead of time. A lot of companies that I'm dealing with they're implementing this already for the fact that they just want to know that everybody coming into their place of business is healthy before work starts. So it's not a bad idea to get this now. The other problem is everybody's buying them at the same time. This one that you see the picture of here was from Amazon, and it was between $60 and $70. My suggestion is to purchase them now so that it might be a few weeks before it comes in. Part of all this, and within the plan, we should actually talk about training for employees. Training is actually something that is mandated by the Pennsylvania State Department of Health. So we need to make sure that through some sort of way that we're training the employees on knowing that if they don't feel good that morning, they should not be coming into work. So as you see here, whether it's a fever, cough, shortness of breath, chills, headache, sore throat, whatever it may be, if that person does not feel well, we have to make sure that they stay home. And as you see there, if they continuously feel under the weather, then they should seek medical attention. What's good about having the thermometer on staff, that if somebody says, I don't feel good, they go home and then they come in the next day, then you could take their temperature and know that they don't have a fever for the day. This is all stuff that we've heard before about covering our face. We want to avoid touching our face at all points. That's why we want to make sure that our mask is actually comfortable. So if you think about it, if it's uncomfortable and we're touching it on a regular basis, you're touching your face. You're also, whatever you're touching with your hands is now on your mask and you're breathing that in. So we need to make sure, even with a mask on, that we avoid touching our face at all costs. The only time that we should have it off is if we're taking a food or water break. And then also at the end of the day, we should be putting those masks in like a Ziploc bag. I know a lot of people probably just throw it in the back of their car and then they grab it again the next day to use it. But once again, if the virus is on that mask, it's not helping anybody. So make sure we have more than one mask available and launder our masks every day if necessary. Obviously, we want to have social distancing. It's not a bad idea to have signage throughout our buildings, whether it's our own employees or our customers. They have to know and understand that they have to be 6 feet away from people at all times. Now, if they do have to get closer than 6 feet, for instance, if you're on a construction site or something like that, and you have to do a team lift or assist a coworker, we should probably get approval from our supervisor first. And once again, do it in the safest manner possible, which would be social distancing, or I'm sorry, not social distancing, wearing gloves, masks, anything you do to prevent from getting close to the other person. Gathering in groups. Now, I know in the past, it seemed like everybody got together for meetings, and once that's after the meeting, you thought, well, that wasn't necessary. So all unnecessary meetings should not happen. If you have to meet with people, let's do it via Zoom or via memo, whatever it may be. We want to avoid getting in large groups at all costs. Same thing when it comes to taking breaks and lunches. Well, number one, we need to make sure that everybody's washing their hands before and after they eat. And then also we want to stagger the breaks because we do not want employees congregating. Obviously, you can't eat with a mask on. So that means if you are going to be eating next to somebody, we should be 6 feet away or further. But the best scenario would be to eat by yourself away from other people. Now, we do want to put some practices in place, which is part of the employee training. My suggestion is, and you can't make people do this, but what we want people to do is pack their lunches. We don't want them going out for lunch, going to unnecessary stores or gas stations when they don't have to. When you're coming into work, they should only stop for emergencies. They shouldn't be stopping just to grab a coffee. I mean, to me, that's completely unnecessary. And once again, you're putting yourself, and wherever you go during that day, you're bringing that into your workplace. So remember, you're putting everybody else at risk just because you wanted to go get a coffee. Okay, so we wanted to bring our own drink to work and make sure it's labeled so that nobody else drinks it. Water coolers and stuff like that, if we have them, just make sure that we have the wipes available to wipe them down in between uses. The biggest thing that we've got to think about is refrigerators. So whether it's a break room, an office, whatever it may be, everybody has the communal ketchup, salad dressings, whatever it may be. That should all be thrown away prior to everybody coming back to work, because we don't want people handling the same thing on a regular basis. Obviously, we want to avoid touching our face. We need to have hand washing facilities available for everybody. And what they say is if you can't do that, we need to have disinfectant available. At the end of this webinar, some of the things that are going to get sent out to you in the compliance kit, we do have a company that we deal with through Keystone that is out of Illinois that actually is mass producing disinfectant. So you guys will get the information on that if you're having a hard time finding it. Workers should also change out of their clothes prior to arriving inside their home and wash the work clothes. So I know that some people like wearing the same jeans, multiple times throughout the week. Shouldn't be doing that, because if something like that gets on the surface, it could withstand up to 24 hours on a porous surface like that. We want to wipe down our vehicles frequently. So we should all have disinfectants in our vehicles, because once again, whatever we're bringing from the outside, we're bringing into the office. So that's something else we should mention to the employees about social gatherings outside of work. If, this weekend's supposed to be a half decent weekend, it's Mother's Day, you're probably gonna have a lot of people being around a lot of people they haven't been. Just put the reminder in their ear that, they're putting everybody else at risk by doing that. As discussed, we want to clean our hands often. I'm sure you've heard this a million times, but we need to clean them for at least 20 seconds, which is singing happy birthday 2 times. Soap and water, they said that the actual temperature of the water doesn't necessarily matter. It's the action of rubbing your hands together. So what we want to do with the soap. So what we want to do is make sure that that's available. And if it's not available, we'd have to have an alcohol-based hand sanitizer. Now, a lot of people you'll see are wearing gloves. And the problem that I always have with PPE is that people think that they're invincible at that point, just because they have gloves on. Well, if you think about it, you think you're safe, but once again, it's the same thing. It's just not being on your hand. If you have gloves on, you're going to be transmitting that virus to other surfaces. So if it is necessary to wear gloves because it's part of your job, don't make sure that that's not part of your illness prevention. We should still be washing our hands, keeping them away from our face, not touching other people, practice social distancing, all on a regular basis. And like I said, all these things should be in our plan. We will have a template plan, but if you guys did want to go a step further and get help with the plan, East Coast Risk Management can definitely help you out with that and employee training.
Well, Mike, that's a lot of information. Some of the things come to mind, if you haven't heard, is to have a written plan and also make sure you train your employees. You do want to probably keep visitors out of your office or your facility as well, just to decrease the risk. And even though you can probably get back to your facilities and you can be open, you may want to still have your meetings done by Zoom, even though everybody's in the office. One other thing that you might want to consider is the mail when it comes in. You may want to have it set aside for a day just to hopefully have the virus that might be carried in on the mail basically fall off of it. So, well, with that, I'm going to turn over to our HR director, Jen Roman.
Thanks, David. So the first thing that I want to talk about is if you're sending employees home that are experiencing symptoms of COVID, when should you return them to work? So if the employee's not being tested, you can return them to work if they've not had a fever for at least 72 hours and haven't used any fever reducing medication during that time. if coughs or other symptoms have improved, and if 7 days have passed since they first experienced the symptoms. Employees that are tested for COVID, they can return to work if they no longer have a fever, if coughs and other symptoms improve, and if they receive 2 negative test results in a row. So also, there are required postings and some suggested postings that we're recommending. The first is a required posting. It's the FFCRA poster, which explains emergency paid sick leave and the expanded FMLA guidelines. We're also recommending posting the CDC cleaning guidelines. They're available on the CDC website. And this will just give your employees guidelines because they will have to do cleaning after they use various common areas during the day. So it will allow them to easily see what they have to do to disinfect the area. We also recommend posting your sick employee guidelines. So what is your specific procedure if an employee feels sick at work? You want to make that readily available to your managers and employees so they don't have to spend additional time looking for those guidelines if someone becomes sick at work. The important thing right now is communication is really key. It's better to over communicate than under communicate. And with some of the things that are a little more difficult with the employees to implement, like masks, you do want to deliver the why, because that will just help the employees understand why they need to do the various things that they'll have to do to follow the guidelines at work. So as you're thinking about your policy, you want to think about how you're going to enforce those guidelines because there is liability involved for the employer. You want to make sure that whatever consequences you're applying are consistent across the board, and what the consequences of not following the guidelines will do on a large scale and a small scale to your business. So, as Mike and Dave mentioned, if you can keep your employees working remotely, you definitely want to do that. And you want to decide whether what type of disciplinary action you want to apply if employees aren't wearing masks at work or following social distancing guidelines. And then thinking about service to your clients, right now in the red and yellow phase, most businesses are not allowed to have clients in their physical locations. Some exceptions include food suppliers, employers providing medical services, and medication suppliers. Most businesses are allowed drop-off and pick-up services. So if you're reopening, you want to think about setting up an area where people can drop off and pick up things. And you may also want to think about where your drop-off and pick-up area is. Is there a way that you can block additional access to your physical location? Clients and customers are required to wear a mask unless they are visiting a food supplier, medical services, or medication supplies. There are exceptions for medical conditions, and right now documentation isn't required. So you want to make sure that you're aware of the guidelines for your business as you begin to open to customers and clients. If you're returning employees from furloughs, keep in mind that they do need to be returned to the same position. Technically, a furlough is considered active employment, so there'll be no break in their employment. Their benefits should have continued during that time, as well as accrual of benefits, including PTO. And you do have the option to keep some of your employees furloughed. If you decide that you won't be returning some of your employees or that the furlough will be long-term, you will be able to transition that to a layoff. And conversely, with layoffs, They don't have to be returned to the same position or same pay, so that does provide some flexibility for employers to adjust to lower volume. So if you had 2 employees doing 2 different functions, you may want to try to combine that position. You don't have to return all of the employees again at once. And there is a break in employment, so there may not be an accrual of benefits like PTO, but with waiting periods for benefits when you're bringing employees back from layoffs, you should check with your benefits broker or carriers because they are making exceptions on waiting periods. So what if your employees refuse to return to work? A lot of employers are saying that with the enhanced unemployment benefits, employees are not real excited to return to work because they're making more with unemployment. So if physical work is only available on site, you should try to understand their reason for refusal and explore those options before you call them back so that you're aware of what protocol and consequences you should have in place. When you do hear the reason for the refusal, you want to make sure that there aren't any exceptions. Like if they don't feel safe, are you following all of the appropriate guidelines? Because if you aren't, they may have a valid reason to refuse to come back. And then with those refusals, when you do your callbacks, you should advise them of things that could change as a result of the refusal. So one example would be benefits. If they're on a furlough or a layoff and you're continuing to pay for the cost of the benefits, if they refuse to return to work, they may have to go on COBRA, which would likely significantly increase the cost of their benefits. And then, is childcare an issue? Because if it is, even if you're calling back your employees, they may be eligible for the expanded FMLA, so you'll need to explore that with the employee. And then understanding the refusal and documenting it is very, very important. So once you have the reason, you want to send a letter to the employee documenting it. And this can be used to send to employment for eligibility consideration. And again, you want to explore your policy and consequences. The best practice right now is a conservative approach. They are saying that a lot of claims will likely arise from employer missteps. So making sure that you're applying things consistently can help you avoid claims.
So that's all pretty good information. What comes to mind is if an employer is not following these guidelines, you're probably opening yourself up to employment-related lawsuits. So that's something you need to pay attention to, work with your HR professional or HR team to make sure you're staying in compliant. But ultimately, this all goes back to the best practice of, having a process to identify and manage your risks. So basically, to summarize what we've gone through so far, you should review your written workplace program and train your employees. You should have a balanced plan to address both your needs as an employer, as well as the needs of your employees, their health and safety, as well as your customers or even third parties. It's a monumental task, but try to stay up with the ever-evolving decisions of the CDC and the state health departments. You need to implement a program, and I repeat, train your employees. Be open to, and honest with your employees with regards to what's going on, what you expect, and what you're ultimately doing. Because as long as you're flexible, I think you'll have a better outcome. After going through all those details, I wanted to go through some high-level things that need to be looked at, both as, let's say an employer myself, or as the risk manager of our organization and our clients. There's quite a few things that you probably should be looking at that you need to track. If you had an employee that is changing their duties due to you changing your operations, you need to track the date that they changed that position, so that, because it could have implications as to their workers' compensation class code, for example. You might not want to, with that change, you may end up overcharging yourself or being overcharged by having them in the proper classification the entire year. You can change during the year. And if an employee is also changing duties, make sure you train them. Make sure they have what they need to do to succeed. That's important. But if you have employees, let's say due to the PPP loans, that you're paying to stay home and not work, you also need to track that payroll. If not, that payroll may be included in your regular classifications and could end up giving you to be overcharged on your audit. It also applies to employees that end up going home under the new laws relating to COVID and still being paid. You need to track your injuries. You may have had an employee that was out on injury prior to the shutdown that may have gotten lost in the shuffle or having difficulty getting doctor's appointment and is still out on workers' comp. Or you may have one that becomes injured here shortly after reopening that could have the same issues. It's conceivable that you have an injury cost that, in essence, could expand or blow up. You need to get control of that, because the bigger the claim becomes, the more it increases your loss ratio, your experience modifier, and ultimately your premium. You do need to track employee illnesses. One, because it does become an OSHA recordable, but you may also want to do an accident investigation to determine the actual root cause of the injury, or in this case, illness, because it's conceivable that they may have, let's say, been exposed outside of work. So you need to be able to have the documentation and track that information. All of these can have an impact on your experience modifier. Claims that become bigger than they should be. But more importantly, we do have a number of clients, particularly those contractors and manufacturers, that have what we call experience modifier sensitive contracts. If their experience modifier goes over the average of 1.0, they can actually be thrown off the job or lose their contract. We did an analysis of what just a 25% reduction in payroll would do to someone's future experience modifier. It could increase your experience modifier by 4 to 19%, depending upon class codes. Therefore, if you are experience modifier sensitive, we need to know. We need to deal with things differently. And in reality, assuming you have the cash flow and you're able to do it, you may want to have those employees get audited out in your regular rates versus in a lower rate. But ultimately, we need to make sure that you have some cost drivers that we control those so they don't get out of hand. Hiring. And when it comes to reopening, there's both opportunities and some threats when it comes to hiring today. Just think about it. Over the last several years, it is very difficult to find good employees. So you may be able to find, and there will be some talent out there that you can actually maybe upgrade your staff. And maybe you don't want to bring that problematic, drama-causing employee that you laid off. However, most employers are going to quickly try to retain their best talent. So you do need to move quickly to try to bring in any additional talent, but also be careful that who you're hiring may also have their own issues. You may want to make sure you have solid hiring practices, maybe even with some behavior-based questions, personality testing. You may even want to do fitness for duty testing to make sure you're not going to hire an injury that can end up on your experience modifier or future premiums. And with that, we're going to open it up for some questions for our panelists. Let's see. Here's a question from one of our attendees. How many masks are we required to provide to employees? They ordered surgical masks for their employees, and even though they asked them not to, the employees had just been tossing them away after one wear, which is obviously costly. So any suggestions there?
Yeah, I'll take this one. So basically what they say is you have to be able to provide masks to the employees, but also the type of mask you have doesn't say. Like I said, it does not have to be an N95. And personally, I probably wouldn't be buying the throwaway masks for the fact that if you buy the ones that are cloth, which seem to be pretty readily available today, or if they bring their own, they could be laundered and reused. So we need to make sure that a lot of the companies are buying the cloth masks, like I said, and then it's making sure that they know how to launder them and bring them back on a regular basis. If we continue to buy the throwaway masks, you're going to continuously see them getting thrown away.
Okay.
The other thing too, I just want to point out that I didn't mention that kind of coincides with this question is that OSHA has what they call the general duty clause, which basically means that we got to provide a safe work environment for our employees to work in. So this would fall under that. I think if you bought them cloth masks that are permanent masks, that would suffice.
Okay, that's good, Mike. I think you actually addressed this one, but we were talking about masks and gloves while relating to or creating an increased risk to safety of employees.
Yeah, I mean, so gloves, I did see that question come through. So I could see gloves, in certain criteria. Well, remember, gloves are not required. Gloves would be optional. So, I mean, if somebody's doing something like using an angle grinder or something like that, where typically they don't want people to wear gloves because they can get caught in something like that, they don't have to be wearing gloves. Now, the masks, I don't see a scenario where it would really hinder the safety of an employee. I mean, even if they're doing welding or something like that, that mask is going to be on underneath their welding helmet. But once again, it probably could be a case-by-case basis. The only thing I could see where it would be an increased risk to an employee is if they had COPD or something like that, where they are not allowed to wear a mask. At that point in time, you have to evaluate their job, see if they can practice social distancing in your place of work. And if not, we can't bring that person back until this stuff's over.
Okay, what guidance do you have for companies who employ consultants and sales teams that have accustomed to traveling regularly, interacting with clients at customer sites across the country? What liability do we have for traveling from site to site? We're also saying that at best you should try to prevent that, but one of the issues that we have is, are you actually covered for the transmission of disease? If they can say, and they'd have to be able to prove that you were the one that brought it to somebody else's facility. But obviously, if they find out that that employee became ill and then after they visited that facility, other people became ill, they may have a case, and that may or may not be covered by your general liability depending upon your policy. So that's why we're saying as a best practice, we understand the relationship side of this, occasionally going to see somebody, but obviously if you are seeing somebody face to face, we're talking about wearing masks, social distancing, but ideally it'd probably be better to try to do some of those via like a Zoom meeting like this.
Yeah, if I could chime in on that, I mean, what they're describing is exactly what I do. I'm going across the country on a regular basis, 1 to 2 times a month I'm traveling, and I haven't went anywhere since this whole thing started. I mean, I've learned that Zoom has a lot of different potentials with some of these meetings that I thought couldn't be done unless you're face to face. Like I said, I've learned that you can do that. So if it's unnecessary for that person to go travel, they shouldn't be traveling.
Yeah, and along that lines, myself and one of your coworkers, we actually did a video tour of a business that was looking for some help and some guidance. And the operations manager took us around the facility and used his phone to be able to show us everything going on at their plant so that we didn't actually have to go into the plant. But so that's good advice. So I guess with that, I think we've addressed everything. Oh wait, there's one more. If someone eventually does, let's say one of your employees does get the virus, the only recourse that employee has against is the workers' comp and employer's liability insurance. They can't circumvent that. But if, let's say, you now have 2, 3, 4 employees that become ill and one of your employees comes ill and their family member becomes ill, we're back to that could be an issue under your general liability. So that's why it's very important that you try to keep your employees safe and follow these guidelines, because otherwise you're opening yourself up to liability. And at that, I do believe we've addressed, I do not see any additional questions. And with that, well, we appreciate, on behalf of myself, Mike, and Jennifer, and the Duncan Financial Group, we appreciate you joining us for this information. If you have any additional questions, please do not hesitate to reach out to us. Our contact information is on the screen. And with that, stay safe, stay healthy, and goodbye. Yeah.